We have the mechanisms to attach to a caregiver because we rely on it to survive.
What did you have to learn to survive, and what did it cost you?
Through that process, we learn something about our self-worth.
About whether we're worthy of care, about whether help will come, about whether we're on our own.
It's not the experience or the event that happened that matters.
If it's not the event, then why does your body still remember it? Dr. Rana Pishva is a clinical psychologist whose work focuses on trauma, attachment, and the stories we carry forward. She's the founder of Sorted Mind, a space created to move beyond quick fixes and make room for complexity. On the Enriched Mindset Podcast, we make space for the psychological experiences that don't fit into quick answers. In this episode, Dr. Rana helps us understand how survival shapes the way we see ourselves and what it takes to gently loosen those patterns. Without further ado, let's get into it.
Welcome to the Enriched Mindset Podcast. I'm Mahveen, a third year at U of T Scarborough, majoring in psychology and double minoring in biomedical ethics and political science.
Hi everyone, my name's Gracie and I'm a second year also at U of T Scarborough, completing a specialist in cognitive neuroscience and a minor in psychology.
And today we are joined by Dr. Rana Pishva, a clinical psychologist with expertise in attachment styles, growth and trauma, and wellness and self-help trends. She is also the founder of Sorted Mind, a project focused on helping people make sense of their stories and the parts of life that feel hard to navigate.
On behalf of all our team, we wanted to thank you so much for joining us today, Dr. Rana. It's a pleasure to meet you. How are you doing?
I'm good. I'm really excited to be here. Thank you for having me.
Yeah, likewise, of course.
And before we dive in, it's kind of a tradition here where we do like a little dad joke at the start of every episode, just kind of kick things off on a good note. So what did the depressed Tortilla say to his therapist?
The depressed who? Tortilla? Oh, I don't know. Wrap me up in a hug?
That's really good, actually.
I don't want to taco about
Here's mine. What do highly empathic psychologists say to each other when they meet?
How are you?
You're fine. How am I? I think the other one was better.
Yeah.
Thank you again, Dr. Rana, for being here today.
Thank you for
And to
having
start off, we just wanted to say we're super interested in your practice, Sorted Mind, and I think our audience would also love to know more about that too. So we know that a lot of your work there centers around trauma, attachment styles, relationships, and self-help and wellness trends, but maybe you could tell us a little bit more about your actual journey into the profession and how you ended up getting there.
I mean, I'm a clinical psychologist. I work mostly in private practice. And when I wanted to start Sorted Mind and go a little bit beyond the one-on-one work, because I think I was getting bored a little bit what was going on. You know, private practice can be really isolating sometimes. I, first of all, kept being told, like, you need to pick something. Pick what's going to be your thing. Is attachment going to be your thing? Is this whole sort of self-focused wellness trend going to be your thing? Mm-hmm. And I have continue to sort of push back against that a little bit because I get bored. And so if I just kind of talk about one thing, I wouldn't be able to do it long term. So I tried to look for a theme in everything that I do, which ended up being transitions and relationships. So in every work that I do, whether it's trauma work or attachment work or work with parents of adult children, it always ends up being, or even perinatal work, whatever, there's always a relationship with yourself, with someone else, and there's always a change that's happening. Mm-hmm. And we need to make sense of that. So when I wanted to sort of launch Sorted Mind, I wanted to go with this idea that I'm not going to be talking about this one thing, but rather about this process of going about all of the changes that we go through in our life. And I wanted to do that with, again, pushing back against some of the, you need to make this in 30 seconds. We are complex, and I'm having such a hard time doing these 30-second sound bites. And when you create something yourself, what's great is that you get to pick how long it's going to be. I started Sorted Mind to give myself the space to do that and to relate to the people that I was relating to on one-on-one, on little groups, and hopefully reach more people to cut through the static of these mental health sound bites a little bit.
Right. Yeah, I love that. It's really important to understand, I guess, the intersectionality as well of all these different sorts of fields. So that's really amazing.
Yeah, so you talk about there, like, you came, like, from thinking outside of the box and not being confined by one specific subject and seeing that, like, thing with relationships, that common trend in everything you did. So you started mine as something that just goes beyond this traditional, like, one subject thing. Yeah. What inspired you to, like, create this, and what do you hope people take away from your work here?
Well, part of it that inspired me from it is because I didn't want to get bored in the one-on-one work that I was doing, and I was coming up with these ideas that I wanted to share, especially when it came through, like, my baby is my integration of CBT and attachment. And so I wanted to have a space to talk about that, and Sorted Mind was a good place to do that. And so what I hope to do is to provide folks, mostly geared towards professionals, but also lay people who are following the work that I do, around what is the type of information that can help them in their clinical work or in their personal life that is evidence-based, that is sound, that is not meant to be compact, that recognizes that this type of work is going to take time and practice and repetition, and make it a resource that can be trusted from that perspective, because I'm not going to put up something that I don't believe in or that isn't supported. Yeah. So for it to be a place of resource and information, but also a little bit of entertainment in the sense that, like, I talk about serious things, but not necessarily taking myself seriously. And if I can give some people some levity as we go through things and recognize when things are absurd, then I'll do that too.
Yeah, amazing. So I guess you must have heard so many different things from people, and also just, like, met so many different kinds of people working in so many different fields. What's something that you've learned from running Sorted Mind that surprised you or maybe shifted your understanding of other people's inner worlds?
Absolutely. When I started Sorted Mind, a big aspect of it, one of the things that it required of me is to actually get online. And I think one of the things that psychologists, at least many of us, of course I can't speak for everyone, we're very sort of, like, protective of, like, our image and wanting to be sort of seen as someone who isn't taking people for granted or selling out our field in some ways. And I had been fairly protective of my presence online, right? Mm-hmm. And having to break that and having to show up online, you're really scared of the way that you're going to be perceived and judged. And I realized very quickly that not a lot of people care what you're putting out there in the world. That's fine. And I realized that the type of challenges that you face in the real world also show up online. Like, someone who is not ready for the type of advice that you're offering is not going to be ready in the therapy room, and they're not going to be ready online. And someone who is wanting a quick fix is not going to read through your whole article. Isn't that different in many ways? And adapting that a little bit, and then being flexible with the way that I provide my information. So breaking it down in little bits, but also having my long articles that I just write for fun. Or if I'm doing consultation groups, one of the big things that I do is provide professional consultation, offering them in little bits and little sessions, but also longer programs, so that it fits.
Yeah, it's everyone's niche.
Yeah,
like you're more so adapting to people than people having to adapt to a sort of like a stereotype or sort of like a traditional method.
That's right. Yeah, I believe in being a generalist in the work that you do, and that's something that I'm not going to pretend I am not. Yeah.
Perfect. So you talk about, like, having to do this shift to, like, not kind of being chronically online and then being chronically online and trying to, like, match up people to their online personas and seeing how it's all not that different. Going with these online, like, types of trends and stuff, what sort of, like, if you could shift one cultural mindset about healing or introspection, like something, you know how people say healing just takes time, like, you just need to take more time, stuff like that, like, what shift would you want that specifically to be? Is there a specific kind of thing we always say that's not necessarily true?
Gracie, you're asking for my soundbite, and I'm trying to not have a soundbite. So maybe that should be my soundbite. I don't have one. But you know what? The themes that keep coming back, that I keep going back to, is that self-care, first of all, taking care of yourself happens when we take care of each other. And when we can find compassion for ourselves, when we can find compassion for others and be curious, this is when change can happen. Just keep going back to a variation of that message.
Compassion is a super, super important, aspect of day-to-day life. And I guess something that connects to that is then your work on self-help and individualism. So I think we wanted to ask you a couple questions on that too. You kind of spoke about this already, like the quick fix thing, but we live in a time where really people are constantly looking for quick fixes or like shortcuts to self-help. So how do you in your practice help people slow down and approach their mental health with more patience and depth as opposed to just looking for a short-term fix?
Absolutely. In whatever work you do, whether it's if I'm working with a professional in consultation or if I'm working in therapy, or quite frankly, when I'm chatting with my parents, I have to meet them where they're at. Right? And so it takes curiosity from me to figure out, okay, where is your capacity, your tolerance, your understanding of where we're at? And when someone does gravitate towards specific self-help trends that are really self-focused, for instance, there's a function to that. What are they getting from this? And there's a lot of appeal to these self-care trends that focus on taking care of you and focusing on yourself and your values and let other people do what they do and you focus on what you want to do, because they give you a sense of responsibility, a sense of agency. And so understanding what it is that actually people are getting from that they haven't gotten somewhere else is really helpful, because it certainly is meeting a need. And whenever possible, modeling that. So in session, modeling the fact that it's going to take a long time for me to understand you. It's going to take a long time for you to understand you. Normalizing the fact that change takes time and making that as much understanding as much part of the work as the work itself or the goal itself.
So you talk a lot about like understanding you, like kind of learning you first before learning what to like do to better yourself or whatever, like the end goal. A lot of this surrounds like self-awareness and reflection. And you also, I know you've explained before about curiosity, like genuinely just exploring who you are as a person. But how can someone tell like when they are exploring their self, like the difference between being self-aware or being self-critical?
Yeah. Well, it could be self-aware, self-critical, or self-absorbed, quite frankly. Self-awareness is a description, right? This is what is happening to me. I'm sweating right now. Or I'm not actually, but like, my palms are sweaty. It is an objective description of what is happening. But when we go into that self-critical or even self-absorbed, then there's a valence associated to it. You're being critical in the sense that there's something about you that is deficient or inappropriate or inadequate. Then you're becoming self-critical. Quite frankly, that's not always a bad thing, because maybe there's something you can do, right? Better. Yeah. But that doesn't mean that you are not enough or you are somehow broken. And being self-absorbed, being so focused on what you're doing, how you're feeling, that you're ignoring what is around you, then that's problematic as well. So I think it's the emotional balance that's present when you're doing that reflection that can help make the difference.
For sure. So Let Them theory, I guess, has kind of taken over social media as a kind of minimalist boundary setting model. How do you see like the strengths and limitations of it when it comes to real actual psychological growth as opposed to just like a social media trend?
When it comes to Let Them theory in particular, Mel Robbins' work is a really nice repackaging of other theories and other ideas that have been brought forward. Kudos to her for the amazing marketing and for bringing that forward. And quite frankly, it is helping a lot of people. There is a lot of positives to that message because it speaks to personal responsibility. You are not helpless. It speaks to the importance of like focusing on what you can control. And like early philosophers were talking about this, right? The roots of stoicism and whatnot. So focus on what you can control versus what you cannot. It offers that simple plan, those simple steps that you can take to make your life better and doing it for yourself and not for other people. So for folks who have felt like they are chronic people pleasers or like fawning is the new thing that you have to unfawn or whatnot, it is this really helpful approach. However, where I've seen it backfire is when folks jump into this approach without doing the work first. And so they jump into saying no when something's not comfortable without asking themselves why, and end up isolating themselves, alienating other people. And then continue to feel frustrated because other people don't change. When we misunderstand what boundaries are and what to expect from them, then we are setting ourselves up for disappointment. At its core, this sort of simplistic approach isolates us because it puts me at the focus of life as opposed to us. And I really do believe that you can't live your life with you at the center of it. This idea that you're the main character in your life, like that's a lonely life, I think.
So you talked a little bit there. I know I heard you like mention about trauma bonding and that, how some people try to approach this let them theory with the idea to like kind of step away from that to kind of be on their own. But then again, like living in solitude isn't necessarily the best thing you can do for yourself. So working closely with trauma and attachment like you do, I know you said relationships between like parent to child, relationships between spouses, and then also like friends to friends, like what's something you wish more people understood specifically about how like our early experiences shape who we become as adults within attachment theory kind of?
Yeah, so it's actually not sort of like what happened to you. It's not the experience or the event that happened that matters. It's actually how you make sense of it. That's what the research in terms of treatments of trauma tell us, is that it's not the intensity of trauma, but rather the story that we tell ourselves about that trauma, about that event, how it disrupted your sense of self, your sense of connection to others, your sense of your own body. And so I don't think about it or talk about it even as that event, but rather that the way that you talk about it. And so that narrative, the story, when you tell me about what happened at summer camp, and it was awful because you were being bullied, for instance, is your narrative coherent? Is it based on evidence? Can I follow it when you're telling me? Or are you like not finishing sentences and jumping back and forth in time? And is it organized in a way? Does it demonstrate some type of reflective functioning in the sense that you're talking about yourself, you're talking about what it could have been like for somebody else? Do you have that capacity? So that we may or may not talk about this, so I'll just bring it up. Like the image that I use is that messy closet. Now, I don't know. I'm so sorry. I don't mean to offend. Might be too young for Friends, but no, you're good. You watched it. Okay.
I watched little clips.
But Monica Geller is like super type A, super tidy, super organized. But she has this one closet, that one, the green door by the bathroom, that is an absolute mess. And Chandler discovers it one day. And I see trauma as being sort of this messy closet. We keep it hidden, we keep it locked, it's closed away, we work really hard to keep people away from it, and even ourselves away from it, because if that closet opens up just even a tiny bit, things just like tumble on top of us and we're overwhelmed with emotions.
Yeah.
And so it almost doesn't matter what's in the closet. What matters is the mess. And the work that we have to do is to make sense of that. Take everything out, make sense of what do I need to keep? What do I need to fix? Because like my belief about this is inaccurate, unhelpful. What do we need to put away? So, your question was like, how do your early experiences impact you today? If you didn't grow up in an environment where your experiences were made sense of, where you had a safe place to talk about, explore, express your emotions, then your closet is going to start to get messy. And that's going to accumulate, and that takes up a lot of room.
Yeah.
Yeah.
And I love that analogy, actually, because I think that's super relatable. I think even just to a lot of people day to day, and I think it's a really easy way to visualize then what's going on actually in your head, especially if you're not super informed on like psychology or attachment styles or that kind of stuff. It's a really relatable way of. So thank you for sharing that. Actually, I think relating to that kind of, many people can name their attachment style, for example, but they don't always like know what to do with that information. And so I guess that kind of circles back to this messy closet idea where you need to like clean it out. But how do you actually guide someone from just knowing that label to making that meaningful change?
Yeah. So I don't mean to be a contrarian here, but actually people are not very good at naming their attachment styles.
Really?
Yes.
Oh.
Because, first of all, because of so much of the myths and how so many of the quizzes online are really simplistic, and they provide a little snapshot of how you're doing right now in this particular relationship. And how you're doing right now in this particular relationship on this particular Tuesday does not necessarily reflect your attachment style, especially if we talk about it in terms of early childhood attachment. And let me rewind for a second. There's two literatures on attachment. There's early childhood attachment, the infant caregiver attachment. This is the work of John Bowlby and Ainsworth and Mary Main. But actually, Mary Main is what sort of helped us do that bridge over to adulthood. But it speaks to the infant's attachment style to their caregiver. And we know that this develops, especially in the first year. We know that it provides a bit of a blueprint for relationship throughout a person's life, but it's still plastic. Then there's this other field of research, which is based more in social psych and adult romantic relationships. The languages are really similar. The words are similar. Of course, we're using the word attachment, but the tools that we use to assess attachment in adult romantic relationships and childhood relationships, they're not the same and they don't predict each other. So part of why people think that they can name their attachment styles is because they're mixing up these two fields of research. So if we think about the quizzes people are doing online, or even if we think about the questionnaires that folks are doing as adults, what they are assessing is a little snapshot set of behaviors. It is not your attachment style as would be assessed by, like, the gold standard is the adult attachment interview, and that would provide a much more layered description of your attachment style. So that's part A of the question. But that doesn't mean that it's not helpful to describe how you relate to other people. When you describe, for instance, someone describes themselves in romantic relationships and they say that as soon as it starts to get kind of personal, I like to pull back, or feeling like their independence is threatened, you're like, oh, okay, so you're pulling a little bit towards that, what we call colloquially an avoidance style. It's helpful to describe, not necessarily to label. But when we describe it, that's really nice, but it's like me giving a diagnosis. What are you going to do with that? So the work that comes from therapy, the change that comes, is from having that awareness, understanding of what's the function of that? What are you protecting yourself from? And how did you learn to relate to people that way? What are the experiences that taught you that is how you're going to stay safe? Stay independent. Don't rely on other people. What life experiences did you have? And then that can sort of like take us back to childhood experiences that can be revisited and organized. And then, well, where do you want to be in the future? If you're satisfied with this, what are you doing in my office? And if you're not, well, what kind of relationship do you want? What are the skills you need to develop? What are the needs you need to learn to meet? I'm so sorry. I feel like I just went on a thing, and I hope that answered your question.
That was really
really good.
interesting. Yeah.
It dissects into, so you talk about like this experience almost.
Yeah.
Where it's like what made you think the way you're thinking right now? If I get close to someone, like I need to pull away immediately. And you also talk about there's an intersection, but at the same time you can't use the same tools for an infant to caregiver kind of attachment versus in a relationship.
Yeah.
So going back to this whole relationship persona, like we constantly hear that if he wanted to, he would, or if they wanted to, they would. Like, and it's always used as like an advantage in a relationship or something. How does that intersect with like attachment wounds it's like self, and how do people like unintentionally hurt themselves maybe because of this mantra, because it's so popular now?
Yeah. Well, just like all mantras, it provides some clarity. It gives you a guide. It sort of says like, oh, okay, so that's why. And then, right? So it feels really good to have that. But the problem with that, and I find that it's similar with any other approach where there's a label given, like, so things like, I don't know, on my feed right now, everything that's showing up is around like immature parents or narcissistic X and Y, right? Yeah. When we label folks, which labels are necessary, but when we label them consistently, it limits us to just this particular even way of being. And it assumes that actions are a reflection of someone's will, of what they want. But rather, our actions are a reflection of our needs, and they're a reflection of our capacity. So is someone acting in a particular way because they're seeking connection with you? If I'm like trying to pick a fight with my husband, is it actually because I'm kind of feeling lonely and I'm like, pay attention to me? And it's not the healthiest way. Like, I'm not sitting here saying that's the way to do it. But there's a way to look at situations. They're like, oh, what am I actually trying to do with this? Or is it, so yeah, of my need to connect or capacity? If someone didn't learn how to ask for help, And the way that they do that is by pulling away, withdrawing with the hope that people are going to come to them, right?
Yeah.
And it's not about them wanting to. It's about doing what they can. That's my frustration with that particular quote. Yeah.
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 Yeah, that makes a lot of sense because I've definitely, like, even just in like friendships and stuff, it's really easy to see somebody who maybe doesn't have the capacity or like the knowledge to be able to actually go back and, like you said, target that root cause. And that's not by any means really they maybe just haven't gotten there yet. So I think that's super, super important to highlight that everyone's at a different stage.
That's right.
So I guess maybe earlier you also mentioned a little bit about the bridging between CBT and then attachment-based work. I just wanted to know, so CBT focuses on thoughts and behaviors on one hand, while attachment-based work focuses more on relational patterns. So how do you bridge the two approaches without losing the depth of each individual one?
Absolutely. So, I was trained very much in CBT, and it is such a great foundational, especially model, and it is, it being the gold standard in the treatment of so many disorders, and it gives you, when you have CBT in your toolbox, it gives you so much confidence in terms of how you can approach psychopathology. But I also recognize, especially as I started to work in fields where trauma was popping up, that not everybody was showing up in the office sort of like ready to address anxiety or even knowing that what was going on was anxiety. And the models just weren't fitting the situation. And when I started to get trained in the attachment-based models, it baffled me how they're not used together more often, and how, like, even being told that they shouldn't. And so the way that I've integrated these two models is by starting with this idea that we are born with the wiring, the capacity, the need to attach. In the same way that we have the mechanism to learn language, we have the mechanisms to attach to a caregiver because we rely on it to survive. Mm-hmm. And how we learn to attach depends on our learning experiences. And our learning experiences is our caregivers. So when I cry as an infant and my caregiver responds, I learn, oh, this is the way I'm going to get my milk. And obviously not in like this like I'm doing this, but like my body learns in the same way that Pavlov's dogs learned about the bell, that if no, that would have been Skinner. Sorry. Anyways, you get what I mean. Anyways, if I do this, then this happens. That's great. So we learn how to keep our caregivers close. Unfortunately, not all caregivers can read your cues effectively. Not all caregivers are available to you in that particular way. Right? Yeah. So because of that, we might have inconsistent experiences of learning. We might have really scary experiences or rejecting feelings as we're learning. So we also adapt and learn tools to survive in our environment, to keep our caregivers close. Consistently, some things are rewarded, some things are punished, some things are reinforced, some things are not. So we adapt. And through that process, we learn different things. We learn something about our self-worth. Am I worthy of care and love? Can I control my environment? Is help available if I need it? Because if it's not, then I'm going to have to figure it out myself. Do I have the skills myself? Am I self-efficient enough to do things? And how safe is the world out there, right? So we learn like these sort of 5 domains. And then there's also things that we don't learn, just like we talked about earlier, someone who doesn't learn how to communicate their needs. And so when I talk about integrating CBT and attachment, CBT helps us identify and learn those missing skills. Communication, thought, restructuring, right? So catching, checking, and changing those maladaptive thoughts. Self-regulation skills, exposure skills. Right? So those are all the different skills that CBT can help us identify and address. And that attachment, what it helps us do is identify what are the unmet needs that resurface in particular relationships. How did those experiences make it that I didn't learn particular skills?
Yeah.
I think an example or more concrete is folks who have experienced a lot of relational trauma and later find themselves making relational decisions that are unhealthy, keep finding themselves in relationships that are unhealthy. If you haven't learned the red flags in a relationship because that's all you know, yeah, that's what you're going to gravitate towards.
Yeah.
Right?
Yeah. Because I guess the red flags start to look green if you don't know what, like.
They start to
Yeah.
look green,
Rose-colored
absolutely.
glasses.
Yeah,
Yeah.
absolutely. If you have learned, grown up in an environment where you learned that you are not worthy to be taken care of, you're not going to expect it from other people. It takes those corrective experiences to say, oh, wait a minute, I don't have to be treated that way.
Yeah.
That's true.
For sure.
I like that one around, red flags start to look green. That's good.
Thank
That
you.
rose-colored glasses.
Yeah.
Okay, so we're going to do a little game of fact or fiction. So, first and foremost, mental health advice from social media is harmful.
I would much prefer if it was can be, but I'll say false.
Okay, so if it was can be, then would you have a different answer, or?
If it was can be, I would say true.
Okay, so it's
Yeah.
just depending on the circumstance, I guess.
Yeah, that's right.
Yeah. Okay, awesome.
Okay, our next one is your attachment style can change over time.
Yes. True. Sorry.
Yeah. Okay. Our next one is your attachment style defines your personality type.
False.
Yeah, this one's really interesting to me, actually. Are you able to maybe elaborate a little bit on this one?
Absolutely. It is, especially if we're talking about this adult attachment research literature, it is much more accurate to talk about our attachment as being a little bit more fluid and as changing based on the relationships that we're in and depending on the cues that we're being given in that particular relationship. So if a relationship feels safe, then we might be able to relate safely to that person. But if there is components of it that bring to the surface elements that are threatening to us, then we might react either in an insecure, detached or avoidant way, or a more preoccupied, anxious way.
Okay, awesome.
Okay, and then going back to the let them theory, it can make you emotionally detached. I know you talked about how it's harmful to go off on your own and to think this world is my oyster, like I'm the main character type of thing, but what do you think about this one?
True.
Yeah. I can see how that would be the case.
Yeah.
That makes a lot of sense. Yeah.
Especially putting yourself...
When you take it to the extreme.
Yeah.
Yeah.
Okay, the next one is let them theory can shield you from being disappointed by others.
False.
Okay.
Yeah, I think it's a nice way to try.
Okay.
Yeah.
But like in the end, that disappointment still always makes its way through, especially like going off and trying to be the main character and realizing how you're alone almost.
It can, because if you say, let them as being sort of a way to set a boundary, like let them do whatever they want, I'm not going to be bothered. Well, you're not fooling anyone because you're not a rock, and other people can still do things that disappoint you. You can still be hurt by it, even if you're keeping distance. And I think that's what people find themselves being frustrated with this approach, is that how come people are still disappointing me? It's because you haven't accepted them for who they are.
Okay.
Yeah.
Shield's not.
Yeah.
Okay. The biggest emotional breakthroughs happen through big emotional events.
False.
Yeah, that one's also super interesting because I feel like even intuitively I would probably think, if I'm having this emotional event, maybe I'm going to have some self-growth or something. So could you maybe elaborate on this one as well?
Yeah. And this isn't to say that big life events don't have big impacts on us. But I do think that there's a bit of the experience of an aha moment in therapy or a magical moment even in real life outside the therapy room is sort of is overblown or overstated a little bit. It has a lot to do with the little steps that you take every day or as often as you can to make change. And then one day you'll realize, oh, I am not that upset that my friend hasn't texted me right away. Oh, that's a change. As opposed to coming to this huge realization and then not being bothered by something anymore.
Yeah.
Like we
It's more
chip
of a
away
journey
at
to
this.
kind of get there.
Yeah.
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 That's super interesting. Yeah. Okay, this one is positive affirmations automatically boost your confidence.
False.
Yeah.
Yeah, I think we've all tried this one before.
Yeah.
Going into an exam, trying to be like, you know what? I know my stuff. I'm
Yes.
all good. You still have that nervousness behind you.
Yeah. Absolutely. Yeah.
Yeah, sometimes
It doesn't
it's
change
like,
reality. Like,
exactly.
You don't know stats, you don't know stats.
yes, I know. I know my stats. I am stats, right?
I want to be you.
And it doesn't, yeah.
Okay, feeling inspired means you're making progress.
False.
Okay.
Yeah.
Yeah, maybe
It's a false like facade.
Not necessarily, like,
Or-
it can be, right? I don't want to, it's just, because it's an absolute, I wanted to kind of be like, no, it can be in the sense that, like, maybe you feel safe enough to have ideas and be creative and be, like, absolutely, it can be a sign of progress, but it could also, feeling inspired could also be a result of you being high, or you starting a manic episode, or you doing, like, there's so many reasons, and so for that reason, I say false.
Okay.
Yeah, that's totally fair, actually. Yeah, I didn't even think about that. Okay, adding new self-help practices to your routine is more helpful than removing unhelpful patterns.
False. Both can be true.
Okay, so like you'd say a little bit of both in moderation?
Absolutely. It's what's going to work for you, fit in your life, and be sustainable, really.
Yeah. Yeah, that's fair. I guess having a sustainable and achievable goal is probably the most important thing, because if you set a goal and you can't meet it, then
And
it
adaptable
was really,
as well.
yeah, for sure.
Okay. The best reflection happens with other people, like in conversation.
I would say true, because, you know, of my philosophy of the way that I see things. That's not to say that
yeah.
good thinking doesn't happen alone, but I think that in connection, better things happen.
Like going along with that, do you encourage like kind of the self, like talking to yourself, like really working things out through a conversation with yourself, like probably like in your head or even out loud?
Oh, absolutely. I mean, I journal, and every client walks out of my office after their first appointment with a journal, and we work, like, I encourage journaling with every client, because it can be like a conversation with yourself and the different parts of you, right? A part of you that really wants to end a relationship, a part of you that really wants to stay in a relationship. And so, yeah, absolutely.
Yeah. Okay, and I think that was our last one. So thank you for
thank you.
being
These are
part of our
good.
game. We're going to go back to our podcast questions now.
Okay,
Sure.
so going back, I know we mentioned a lot, like how I viewed like what you're saying. Correct me if I'm wrong. Like
Yeah.
you were talking about basically the evolution through someone's life. How this this relationship with your caregiver can sometimes reflect in a new relationship, and how sometimes cues look like differently to you depending on how you like grew up. And like in your experience, to shift your mindset, especially after maybe you've had an aha moment like in a relationship, being like, why am I like this? Why am I always like maybe looking for someone who's not the best person for me, someone with these red flags that we keep viewing as green?
Yeah.
Like, how can you better support yourself moving forward and shift from that mindset of why am I like this to like, how can I better myself?
I think the question that you're answering is asking really is like, where does change come from? How do I make the changes in my life that I'd like to see? How do I go from here to there? And that space of awareness of like, what I'm doing right now is just not working anymore is, of course, the place to start. And then gaining the sort of emotional capacity to explore what is going on, but understanding, how did I get here? As we talked about a little bit earlier, what are the experiences that I had where I learned this is the way to behave in this context? Having that with compassion and understanding, compassion for yourself, but also even the other people who were involved at the time, right? Having that understanding, and then figuring out what are the gaps in terms of the skills that I have. Do I need to focus on my emotion regulation skills? Do I need to focus on my communication skills, on my assessment of threat? Because I'm seeing everything as being dangerous even when it's actually not, right? Or the skill of asking for help. What are these sort of childhood wounds that keep coming up to the surface? Whenever someone doesn't respond to me right away, I'm worried that they're mad at me. Okay, what was that about? And then going to that part of the closet and making sense of that so that it doesn't take up so much room anymore. If that used to be a whole shelf, maybe it's just a corner. That doesn't mean it's not going to be hurtful, but it's not going to sting as much. So developing those skills, making sense of those past experiences and unmet needs, grieving the things that we didn't have, that we're not going to have. You're not going to have had that childhood. You're not going to have had that particular relationship with this person. And moving through that grief with compassion for yourself. Sometimes there's room for forgiveness, whether it's us or other people, and that makes more room for action. And then I think the most important part in all of this is practicing all of the previous steps over and over again, because you're gonna, one of the things that walks so often in my office is like, why do I keep doing this? I know I'm not supposed to. I'm like, okay, we're either missing something or you've actually made progress. You just need to keep practicing.
Yeah.
Right? Chipping away at that. And that it's gonna take, think about how many times you went through a particular pain and now you have to unlearn it.
Yeah.
So those would be like the way that we'd move through that in therapy, if that makes sense.
Yeah, no, that definitely does. I think, oftentimes we talk about growth like it's a destination, and instead, like, not understanding that that's maybe more of an ongoing relationship with yourself, and kind of having to circle back maybe to the same thing over and over again to finally, heal as best as you can from whatever it was, right? So, I mean, I guess, what does it look like to help someone understand that growth is an ongoing relationship as opposed to a final destination?
As a therapist, it means to keep showing up for that person, right? Mm-hmm. And that when they tell me, oh my God, you must be so sick of me coming in here and talking about that, and I'm being like, I'm okay, but are you sick of talking about that? Like, it seems to me you are. Like, what are we missing? What are we not, right? And very often pointing out the bits of progress they're making that they haven't really noticed themselves. Where I'm like, you know what? Last time if you would have told me about this, you would be bawling on the couch. And right now you're just more annoyed than anything else. And knowing, and I wouldn't say it like this. I mean, depending on who it is. But anyway, so pointing out changes that they've made where I'm like, you would not have made it on time for a 9:30 appointment 2 years ago. But you have things on track enough to do that now. So pointing out the progress that's being overlooked and then to keep showing up for them and helping sort of this shift towards a goal-driven life from like a goal-driven life to a value-driven life of like, I want to be in a stable, I want to be married by the time I'm 30, right? And like, okay, that can really set you up for disappointment. What's the value behind that? Is it family, companionship? Like, so that you can make decisions that are in line with that rather than like this really rigid rule, and helping them find what that path looks like.
Mm-hmm. Okay. Yeah. So like you talk about like the having a goal versus and its value kind of thing. Mm. We see a lot of people who are like, we call them like high functioning adults, where it's like very much they have these goals, they're trying to consistently meet it. I don't know if you see in your demographic for patients as well, if you see as much as these, because they're convinced they have this functional trauma where they seem successful, even calm, but they still have this trauma that's hiding behind their high functioning. Like, what do you have to say like about them, and like how are they doing this?
Yeah. Well, how to do this? There's quite a few trauma models that speak to that. So for instance, like Janina Fisher's structural dissociation model talks about this sort of going on with everyday self, the one that's kind of showing up to work, raising the kids, doing all that, and then that trauma self that has maybe even many different parts, right? And because life does go on and you have to kind of continue to meet its responsibilities, but sometimes some people are overdoing it, and there is this culture of like hyper optimization of like always focusing on doing the best workout and the best, morning smoothie or whatever it is. And if I start to observe that in a client, or if someone describes themselves as being a overachiever or workaholic or whatnot, my question becomes of what's the function? And I think about this as like this spectrum of, on the one hand, there's inertia of someone kind of, life is completely out of control and they're just doing the same thing over and over again and nothing's happening. And then another type of avoidance on the other side of this sort of hyper functional productivity or whatnot. And they kind of look like they've got it all together, but really they're not able to sit still and they're not able to do anything else. And both of these, at both ends of the spectrum, whether it's inertia or like hyper structured, then it's about avoidance. It's about avoiding an uncomfortable feeling, because every time I sit down, I've got these traumatic memories that come into my mind, and so I'm just going to keep working. Yeah. So it's about asking about the function of the behavior. What are you getting out of doing this? What are you avoiding out of doing this? What are you soothing out of doing this? So we try to figure that out. And my job is to challenge it.
Yeah. No, that's really interesting, I guess. There's a lot of people that maybe will just push through whatever's going on, and you don't even realize that you're doing that until you really sit and you think to yourself, you're like, wow, this thing happened, and
okay.
yeah, exactly.
Like, baby, that's so great.
Now
Yeah.
what? All of this happened. Yeah. And there's a part of me that also says, you know what, sometimes you do have to push through. Like, I remember like having 8 exams over 2 weeks, and I'm just like, okay, this is not the time for self-reflection. I just have to like and do it, because life will demand that of you sometimes. But being able to recognize, this is what I'm in right now. This is going to end on December 22nd. I'm going to be like good, and I'm going to, and even then, like having tools throughout and peppering that self-care, right? Recognizing that this versus living your life that way is really different.
Yeah, no, for sure. Yeah. So I guess there's also, I mean, a growing awareness of trauma, but with that, I think there comes a growing misuse of that word also in certain circumstances. So how do you, I guess, navigate educating people about trauma and the meaning of trauma and how serious it actually is without minimizing their experience and kind of still validating what they went through?
So here, I think that as a clinical psychologist who, like in our province, in Ontario, we can diagnose, I am very specific about the way that I use trauma, in the sense that I use it as the diagnostic term, and I find use other words when it is not used in a diagnostic term. And I talk about trauma as a reaction to a particular event. So your nervous system was overwhelmed by the demands of that situation because of fear of life to yourself or to somebody else, or fear of severe injury, not being able to control that particular situation. So I'm actually quite specific, because I can take that diagnostic perspective and say, hold on, are we talking about da-da-da-da-da-da? We're not? Let's find another word, right? Or let's find a different way to talk about it. And quite frankly, that's always been really well received with the clients that I've talked to about this. And in some literatures, or you'll find like big T trauma and little t traumas. And that's sometimes helpful as well, where it's like those little t traumas are not life-threatening, but the cumulative effect of it. And I think especially when working with marginalized populations, those sort of like repeated micro experiences of being judged, being excluded, being discriminated against, have a huge impact on someone's nervous system that is comparable, if not sometimes worse, than a big traumatic event, right? So we have to think about the impact of that particular or numerous events. And because of the work that I do, I kind of take a diagnostic frame from it. That's kind of the way I've kept myself safe in this big discussion. Yeah.
I don't know if I'm interpreting this right, but I guess seeing trauma as like a spectrum, and that there's varying like degrees to which, I'm not sure if I'm interpreting that right.
I wouldn't see it as a spectrum. I see it as a response to a particular event that has overwhelmed your capacity, or in terms of survival and coping with that particular situation. When we're talking about a diagnosis. And if it is not that, then we're gonna talk about it differently. Maybe we'll talk about it as a small t trauma. I'll talk about attachment wounds is a big way that I end up talking about that in therapy. So we will unpack that a little bit and talk about it more as like a relational wound that you have, which doesn't mean you can't end up having a trauma-related disorder. But with trauma in particular, I really try to focus on it is a reaction, and we have to be careful how we use it because it's a diagnostic term.
That makes sense.
I hope that makes sense.
No, that makes more sense now. Yeah, thank you so much. I just think I wasn't. Yeah, thank you so much.
I hope this came out clearly. Send me your questions if not. I'm happy to I can. But
yeah, of course. But thank you. That was a really good explanation. Yeah, thank you so much.
Okay, so piggybacking off that, I know we're getting into the trauma now. We're getting deep into it. You're saying how it's a response. Like in diagnostic terms, it's a response to an event or something. Do you find there is ways that trauma occurs and people don't immediately recognize it as trauma? Is there a way that they do? Do you see a pattern in how they recognize it? Or what are some of the more subtle signs that you wish people would have paid attention to earlier to start recognizing trauma? Is there a kind of when you're just like in your own kind of state and you just don't realize... Like you're just like la da da da, you know what I mean?
Yeah. Well, I think that happens especially when folks are still in the traumatic event and they think that it's over. And we were talking about this a lot, especially over COVID, when people were like, how are we going to overcome this? How are we going to do it? And I'm like, we're still in it. Like, we're not going to like right now we're still coping, we're still surviving. Or folks who are getting treated for trauma that is so linked to a socioeconomic or cultural experience, for instance, but they're still living in the conditions where they're being traumatized, right?
Okay. Yeah.
So in those situations, you don't actually know, because this is all you have, like your body has constantly been in this overdrive survival mode. So first it's supposed, like, really, are you in an environment where you're still surviving? Can you even recognize that what you're going through is still? That would be sort of where I would start trying to understand what's happening. And then when we're looking at sort of the byproducts or the consequences, the behaviors that show up afterwards, I go back to my question of what's the function? How is this a way for you to try to adapt to whatever is happening now? When you think about PTSD or trauma-related disorders, it's often thinking about it from a perspective where your brain and your body still act as if you're in that scary event when you're actually in a very safe event. And this happens with first responders a lot, where they continuously react. You know, they're out in a grocery store and there's a little hustle bustle and they're thinking something might be going on, because even if they're off duty, they are trained to be constantly on. And that's exhausting. So it's sort of this, I don't like the word failure, but it's the best way I can put it. It's like a failure for your brain to heal after a traumatic event. And we want to see, is this traumatic event over? Have you gone through that healing process? Have you given your brain that time to realize, oh, I'm safe now. I don't need to worry about this anymore. Yeah.
Okay. Yeah. Awesome. Yeah. I guess we have one last question for you, and I think this kind of circles back nicely and connects everything we've talked about. I think healing often requires unlearning patterns that kept us safe once, or, you know, even just recognizing that there's a pattern that, you know, is unhealthy, but we feel like is keeping us safe. So what do you think that people can do, or what do you think helps people stay compassionate towards themselves while they're doing that work?
Knowing that it's not something that's going to happen overnight, and it doesn't have to happen on your own. Not being afraid to sort of be in community as you're healing. And we have our Western therapy model of 2 people in a room is really different from what happens around the world in terms of healing as a community. And there's a danger to that, because there's also sort of, when you have folks together all talking about their traumas, well, sometimes it ends up not actually making things any better because you're reinforcing negative patterns or whatnot. But knowing that you can heal in relationships and being open to the possibility that your life is going to be different from what you expected, healing is going to be different from what you expected, and being willing to tolerate the discomfort that's going to come with healing, that you're going to be challenged in terms of what you're thinking and what you want to do. So you're not going to do it alone. It's going to look different than you expected. You're going to end up somewhere different, and it's going to be uncomfortable is maybe part of it.
Yeah, I think that's an amazing way to help people face the reality of feeling. No, I guess that it's not, I know people say it all the time, but it's not linear. And I guess just to really recognize that it's a completely different thing to know it. Yeah, I think, well, that was a really great explanation, actually. Yeah, you summed it up really nicely.
I'm glad, yay.
Yeah.
Good.
We wanted to say, again, on behalf of all of us, thank you so much, Dr. Rana, for being a part of this episode. This was genuinely so interesting, and your insights were all super, super helpful, and I'm sure our audience will love them too. We're so grateful for your contribution and for your time with us today.
Well, thank you so much for the opportunity, for your really insightful questions, and I really am really grateful for your time.
And just to add in, Dr. Rana, for our viewers, if they could reach you somewhere or learn more about your methods, about like your sorted mind, like everything, where is one place you'd recommend?
Yeah, everything, they can find all of that on my website, so sorted-mind.com. On Instagram, I'm a little bit more like lighthearted. I'm just having fun with it, but it's at drrana.sortedmind. For professionals, LinkedIn is pretty much where I am the most and where I talk about my consultation and workshops. So depending on what you're looking for and what aspect of the work, you can find me there. And then my articles are on Substack. So put myself everywhere for the different type of works that I do. I'm always happy to chat with folks about their journey in mental health, their goals for the professionals. So I welcome those type of questions. Bring it on.
Thank you guys for tuning in, and we'll see you next time on the Enriched Mindset Podcast.